If you or a loved one suffer from a urinary incontinence condition such as overactive bladder, then you may have heard of oxybutynin. This medication has been gaining popularity for its ability to alleviate the symptoms of urinary incontinence and improve the quality of life for those affected by the condition. But what exactly is oxybutynin, and how does it work? In this ultimate guide, we'll explore the ins and outs of oxybutynin, including how it works, its benefits, potential side effects, and much more. By the end of this guide, you'll have a thorough understanding of this medication and be better equipped to make informed decisions regarding your or your loved one's health. So, let's dive in and discover everything you need to know about oxybutynin. How oxybutynin works. Oxybutynin is an antimuscarinic agent that works by blocking certain nerve impulses that control the bladder muscle. It does this by relaxing the muscles in the bladder, which helps to reduce the urgency and frequency of urination. Oxybutynin also helps to decrease the involuntary contractions of the bladder, which can cause leakage and incontinence. Oxybutynin is available in various forms, including tablets, extended-release tablets, and transdermal patches. The tablets and extended-release tablets are taken orally, while the transdermal patch is applied to the skin once or twice a week. Overall, oxybutynin is an effective medication for treating urinary incontinence, and it can significantly improve the quality of life for those who suffer from this condition. Benefits of oxybutynin. One of the main benefits of oxybutynin is its ability to alleviate the symptoms of urinary incontinence. This can include reducing the frequency and urgency of urination, as well as decreasing the number of episodes of incontinence. By doing so, oxybutynin can improve the quality of life for those affected by the condition and reduce the embarrassment and social isolation that can come with urinary incontinence. In addition to its benefits for urinary incontinence, oxybutynin has also been shown to be effective in treating other conditions, such as hyperhidrosis, excessive sweating, and spasticity, muscle stiffness. This makes it a versatile medication that can be used to treat a range of conditions. Who can benefit from using oxybutynin? Oxybutynin is typically prescribed for those who suffer from urinary incontinence or overactive bladder. This includes individuals who experience urgency, frequency, and urge incontinence. Oxybutynin can also be used to treat other types of incontinence, such as stress incontinence, but it is less commonly prescribed for this purpose. Overall, oxybutynin can benefit anyone who experiences urinary incontinence or overactive bladder and wishes to improve their quality of life. Dosage and administration of oxybutynin. The dosage of oxybutynin will vary depending on the individual and the severity of their symptoms. It is typically started at a low dose and gradually increased as needed. The maximum recommended dose is 5 mg 4 times a day for the immediate release tablets and 30 mg once a day for the extended release tablets. Oxybutynin tablets should be taken with water and can be taken with or without food. The extended release tablets should be swallowed whole and should not be chewed or crushed. The transdermal patch should be applied to clean, dry skin on the abdomen, hip, or buttock. The patch should be changed once or twice a week, depending on the specific product. The patch should be removed before magnetic resonance imaging, MRI, or cardioversion. Potential side effects of oxybutynin. Like all medications, oxybutynin can cause side effects. The most common side effects include dry mouth, constipation, blurred vision, and dizziness. These side effects are usually mild and go away on their own. More serious side effects of oxybutynin can include difficulty urinating, severe constipation, and confusion. If you experience any of these side effects, you should contact your healthcare provider immediately. Oxybutynin can also interact with other medications, so it is important to tell your healthcare provider about all the medications you are taking before starting oxybutynin. Precautions and contraindications for using oxybutynin. Oxybutynin is contraindicated in individuals who have a known hypersensitivity to the medication or its components. It should also be used with caution in those with glaucoma, myasthenia gravis, or liver or kidney disease. In addition, oxybutynin can cause drowsiness, so it is important to avoid driving or operating heavy machinery until you know how the medication affects you. Alternative treatments to oxybutynin. There are several alternative treatments to oxybutynin for urinary incontinence and overactive bladder. These include behavioral therapies, such as bladder training and pelvic floor exercises, as well as dietary changes, such as avoiding caffeine and alcohol. Other medications that can be used to treat urinary incontinence and overactive bladder include tolterodine, solifenacin, and darafenacin. These medications work in a similar way to oxybutynin but may have different side effects or dosing regimens. Frequently asked questions about oxybutynin. 1. How long does it take for oxybutynin to work? 2. Oxybutynin can take several weeks to reach its full effect. 2. However, some individuals may notice an improvement in their symptoms within a few days of starting the medication. 3. Can oxybutynin be taken with food? 4. Yes, oxybutynin can be taken with or without food. 5. What should I do if I miss a dose of oxybutynin? 6. If you miss a dose of oxybutynin, take it as soon as you remember. 6. However, if it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. 7. Can oxybutynin be used during pregnancy or while breastfeeding? 8. Oxybutynin should only be used during pregnancy or while breastfeeding if the benefits outweigh the risks. 8. It is important to talk to your healthcare provider before using oxybutynin in these situations. Conclusion: is oxybutynin right for you? Overall, oxybutynin is an effective medication for treating urinary incontinence and overactive bladder. It works by relaxing the muscles in the bladder, which can reduce the frequency and urgency of urination and decrease episodes of incontinence. While oxybutynin can cause side effects, these are usually mild and go away on their own. If you experience any serious side effects, you should contact your healthcare provider immediately. There are also alternative treatments to oxybutynin, such as behavioral therapies and other medications. It is important to talk to your healthcare provider about the best treatment options for you. If you or a loved one suffer from urinary incontinence or overactive bladder, oxybutynin may be right for you. Talk to your healthcare provider to learn more about this medication and whether it is appropriate for your condition. Thanks for watching.